Canadians trust the safety and efficacy of adult vaccines, but barriers to accessing these vaccines, they still exist. Some regions have expanded free programs this year, while others have pulled back, notably on COVID-19 vaccines in Alberta and Quebec. So today, with the help of a doctor, an immunologist, a pharmacist, and a patient advocate, we're going to discuss vaccines, what's available, where, and why we need them. And joining us for the discussion, we've got Dr. Dawn Bowdish. She's a professor in the Department of Medicine at McMaster University and the Canada Research Chair in Aging and Immunity. Dr. Christine Palmay, a family physician with a practice in midtown Toronto. She's also a physician advisor to the Adult Vaccine Alliance. Dr. Sadaf Faisal, a licensed pharmacist and the Senior Director of Professional Affairs at the Canadian Pharmacists Association. And rounding it out, Anthony Quinn, President of the Canadian Association of Retired Persons, or CARP, a national not-for-profit organization that champions better health care for aging Canadians. And thanks all of you for being here. I know you're really busy. Such an important topic, though, so we're going to dive right in, and I'll start with you, Dr. Bowdish. You're the Canadian Research Chair in Aging and Immunity, so let's get right to it. As we know, as we age, our immune system weakens. So how effective are vaccines in keeping us healthy and letting us lead our healthy lives?
Vaccines still work really well for older adults, and they do a few things. They stop or reduce the risk of getting disease in some cases, but they're also an investment in long-term health, because if you are vaccinated, and even if you do end up in the hospital with influenza, or RSV, or COVID, your chances of getting out and getting back to the life you once led are much better if you're vaccinated. We also know that all these serious respiratory infections come with long-term health risks to the heart, to the brain, and oftentimes people who have a serious infection lose their mobility or independence. So it is critical that vulnerable people get vaccinated to help preserve their health now and in the future.
Yes, and Dr. Palmay, we know that respiratory illnesses are seasonal, so this is a really busy time for you. Are patients, do you find, coming in asking for the vaccines, or are you having to bring it up and provide education around it and prompt them?
'Tis the season. I talk about it being an unholy trinity, RSV, COVID, influenza. I think it's a combination. We have to remind ourselves that while there is an anti-vaccine movement, data strongly suggests that Canadians choose to be vaccinated, want to be vaccinated. I think the question is what vaccines are appropriate for what age range, what type of vaccine can they be co-administered. In my practice, I generally promote vaccines. So, people understand that the season's here. And yes, we have vaccine clinics, but it's not just looking at each individual vaccine. I sort of package things all together. And it's quite easy to have that discussion because risk factors are similar, for those patients who are most at risk. So when patients come to me, they kind of get the triad of vaccines, certainly the influenza, which is new and seasonal. For the highest risk patients, that would be COVID as well. And then RSV if they haven't already been vaccinated. And there's other vaccines that are appropriate too. So it's a combination.
Okay. Anthony, CARP just conducted a members survey on vaccines, access and equity. So what are some of the findings that came out of it?
Well, just like the doctors have told you, Liz, our older Canadians really do have awareness of, and they are supportive of vaccinations. Over 80% are really supportive of accessing vaccines. But the access portion has been the trouble. It was over 30% of our respondents said they weren't sure when, how, or if they could afford vaccines. So the big disconnect is between seniors who really feel that they want to know more and get vaccines, but how they access it. Those disconnects are really, I think, hurting the take-up of vaccines in Canada.
And was there any results around where they wanted to get the vaccination?
Well, generally, they want access, and they're looking for the easiest way to do it. And typically, that would be either with your family doctor or a pharmacist. Pharmacies are everywhere. They're open many later hours, and there's a pharmacist there who is trained and a professional able to provide those vaccines. So access, whether it's provincially funded, the costs have been proven to be a problem. for our members, but access through a pharmacy or a family doctor, the best two routes for them for sure.
And did you ask which of the, whether it's flu or COVID or pneumonia, what's sort of the biggest concern for members?
Well, our members' concern is cost and access. And because the COVID-19 vaccine, and you mentioned it in your opening, has been pulled out of the general distribution for seniors in Alberta and Quebec, they're concerned that they're not going to have access to it or be able to afford it. So the cost factor also plays a part.
That makes sense. And Dr. Faisal, pharmacists have become such a big part of our healthcare and delivering vaccines to Canadians, and it happened pretty quickly. Can you sort of walk us through how that happened?
Yeah, pharmacists, I think we are, like Anthony just said, we are very local. 95% of Canadian lives within 5 kilometers of a pharmacy. Pharmacies are open longer hours compared to a family physician's office, so there is more accessibility. I think during COVID-19, that was the time when people really saw that pharmacies could be a hub where patients can walk in and get their vaccination. We were already doing vaccination. We were offering flu shots. We were offering some travel vaccines. But I think during COVID, it was really the time when people saw that pharmacies could be a hub where you can actually have vaccines available. And because we are so much into the communities, that your pharmacist actually is trained not to just administer a shot. You're not just getting a shot when you are going into a pharmacy, you're actually getting a full medication review where they know what medication you are taking. Like you said, risk factors are there, and there are certain vaccines that can actually help you avoid the long-term complications of your disease condition. So I think that's where pharmacies really play a significant role. So you're not just getting a shot at your pharmacy, you're actually getting like service from someone who really knows you, who knows your community, and who knows your medical condition as well.
And for our members,
Nancy, I was going to say, you have something you want to add?
For our members, they don't always have access to a family doctor. So the role that a pharmacist can play in making sure that they're being advised about the available vaccines and having easy access to them. Now, I'm certain when they do have a chance to talk to a doctor, they're being advised as to what vaccines are available. But just having that really close connection with the pharmacist makes a lot of sense for getting the vaccines distributed as well as possible.
And just a shout out from a primary care perspective, we could not have survived COVID without our pharmacy colleagues. The profession stood up and really opened up doors. And I think as a result, the concept of primary care has just expanded, partially to deal with this access problem, but also messaging, right? If a message is consistent, constant, and repeated, that provides reassurance. So if I mention COVID vaccine, shingles shot, and then they show up at this lovely pharmacy and they mention a COVID shot, shingles shot, those messages, eventually translate, we know, into increased uptake. And they've actually looked at data. So we've asked patients, does it bother you if you have your vaccine administered at a pharmacy? And they kind of look at you and say, why would it bother me? And the other brilliant question that they asked, if you're there to fill your prescriptions, do you just want to leave, or do you want somebody to say, are you up to date, if you're filling your prescriptions for asthma or COPD medications? How's your respiratory, vaccine status? Would that annoy you? And they say, no, it wouldn't. So, we've changed our perspective, and once again, eternally grateful for pharmacy for showing up.
Thank you.
I'm so glad you brought that up, because I was just going to ask you, what's the relationship between a family physician and the pharmacist now that some of that care has been transferred over? So it sounds like it's working perfectly.
Oh, I don't think perfectly.
Symbiotically, like you're both happy with it.
I mean, there's transition, and I think being of a somewhat younger generation, the understanding is that, we have a huge problem, and the only way we're going to solve the access versus demand is to open up the scope of care.
Yeah.
And to be honest, it's not, if my patient goes to a pharmacy to get an immunization, it's not like I have an empty spot in my clinic.
Well, that's the whole thing.
There's a lot of work to go around. out. So
I think that's really what I really want to highlight is that pharmacies are actually here to support the primary care, right? Like we are not here that we are taking patients away from the primary care physicians. It's more like we know that our colleagues are so busy and they have so many things to do. So things where we can really support them, vaccination is one of them. And like you said, right, you are there to fill your prescription. It's like an easy access. Sometimes people are not able to make appointments during the physician's hours because of their work or because of some other things. So pharmacies we are open late, we are open on the weekend, we are everywhere. So I feel like that's something that we can really support with working with our family physicians and also distributing that burden between professions.
From CARP's point of view,
Yes.
it might be better if we could even bring these two professionals closer together. Having to get a vaccine for shingles, for example, getting a prescription from a family doctor before you're able to get the shot from a pharmacist might make a lot more sense, I think, as we're trying to cut down the barriers to access.
Yeah.
But I'll let the experts weigh in on that.
And I'm so glad that we've had this conversation because I think as patients, we were handed this new option, not entirely clear on, who was happy with what. And, sometimes it's like when you get your hair cut at a different hairdresser and you feel guilty. It's like, I see my doctor for my vaccines. I don't want her to think I don't still love my doctor, because I do.
I suspect hairdressers are more valued than I am. I would never switch my hairdresser.
Oh, no, do not say that. I've got the next question for you just to prove it. You had talked about not everybody's created equal. What are the added benefits to vaccines for people with chronic conditions?
So, I think the stage was set, and I'm so thankful for your comment about long-term complications, right? So, as we age, our immune system ages with us. Our tissue ages with us. Additionally, external things happen. You gather diagnoses. Those diagnoses make you gather baggage that's in the form of, any type of medication that may further challenge your immune system. Perhaps living situations change. As we age, we end up in congregate living facilities, long-term care, etc. So that sort of is a compound type of interest you don't want. A patient who comes, who is admitted in the hospital with vaccine-preventable disease, if they have a diagnosis, COPD is sort of top of mind, chances are they will be sick, hence being in the hospital, but their COPD will get worse, and this downward spiral happens. And, mortality and morbidity are significant still for our patients most at risk. Those are obviously important. It's not just the acute phase, it's the subacute issues that can arise, and we'll hopefully talk about some of the cardiovascular complications that can arise after having a vaccine-preventable disease. But the concept of not being able to leave the hospital in the condition that you arrived. So you arrive independent, having a condo, being able to mobilize, being able to travel. But when you leave, this is pertinent to any type of vaccine-preventable disease. I just have a stat for RSV. 1/8, so 1 out of 8 patients who ends up in the hospital with a severe RSV infection leaves not able to return to their home. They leave requiring long-term care. They're dependent on family, a caregiver. That is a frightening statement. We all want to live long, but we want to live long in wellness. And I think that message is often lost when talking about sort of vaccines and this seasonal respiratory season that comes in like a lion, hopefully leaves like a lamb. But there are complications that are longer term that affect the trajectory of a patient's life. And that's a key point, I think, now that I've started really emphasizing when I'm speaking to my colleagues about vaccines, to my patients.
Yeah, you have to think bigger than just this moment. Dr. Bowdish, did you want to add to that?
Yes, I think one of the most exciting observations that's been made in the last little while is the link between vaccines and dementia. And in fact, they seem to be protective. So in my lab, we're trying to understand why there's this strange relationship between having a really serious respiratory infection and an increased risk of dementia. We haven't figured that out yet, but we are now getting more and more high quality data showing that if you get your shingles vaccine, you can have up to a 20% decrease in your risk of dementia if you get your influenza shots, your pneumococcal shots. And so when I think about the scariest thing about aging and losing my dependents, it's dementia. So the fact that we can go to our pharmacist or a primary care provider and get something as simple as a vaccine is something that I think is really something your listeners are going to be excited to hear about, because it's easier than doing all the other things we're supposed to do. It's easier than exercising and eating well and doing all the social engagement and being a lifetime learner. It's an option.
Prevent dementia. Yeah. That's a great perspective. Thank you for bringing that up. Anthony,
And just
did you want to add something?
Sorry, Liz, I always do. The added costs of these knock-on effects of these conditions, that's something that isn't taken into consideration when you show up at your pharmacist or your family doctor for your vaccine. If you get those conditions and you end up in the hospital, you may be forced to sell your house when you're not ready to sell your house, and the cost of assisted living care, if you have to transition to a retirement home with care, those are very, very expensive propositions. And if there's an opportunity to either curtail the effects of the viruses or eliminate them completely, that is something that is very valuable to think ahead for your own healthcare.
And you've brought up this idea of dollars and cents. I mean, the burden on our healthcare system is much larger when you have patients that have additional problems and need the long-term care, need the support at home, and need the medication and the oxygen, and et cetera, et cetera. So, Anthony, why do you think the government has not fully embraced this idea of accessible and paid for vaccines? The more, the better for us all.
I think there's silos in the healthcare system and in the way that budgets are put together, and they're looking for quick returns that show immediate responses to where they're allocating their dollars. They're not thinking of preventative health every time. And when they may say, here's a budget for vaccinations, it's going to be X millions of dollars or billions of dollars, whatever it is, that they don't see an immediate return on that investment. They may see it if they look at how much they could have saved in the healthcare system, but they're not looking at it through that lens. And I think being proactive and helping Canadians to maintain their health is always a great investment for our funders.
Yeah, Dr. Faisal, we heard that about 95% of CARP respondents said that they would like to access a vaccination at a pharmacy without a prescription. So how soon could we see that happen?
So it's already happening. Most of the vaccines that are part of our routine immunization, they don't require prescriptions. They comes under Schedule II drugs that you can walk into a pharmacy. You don't have to get a prescription from your family physician. Pharmacist can give you the medication, administer you the medication. Also, some of the vaccinations such as flu and COVID, the one that are for the mass, like if we are thinking about an outbreak, those are also the one that don't require a prescription. There are some vaccines that still require prescriptions. Most of them are travel-related vaccines or for a younger population, where you will need a medical directive from your family physician. However, there is two portions of this whole thing. You can walk into the pharmacy and you can get your medication administered, but you may have to pay an administration fee to your pharmacist because it is not funded or reimbursed for the pharmacist. Right now, COVID-19 flu shots, they are publicly reimbursed for the pharmacist, so you don't have to pay for those shots. But if you are going and getting a vaccines, for example, RSV, you may not need a prescription, but you still have to pay the pharmacist that administration fee. That is sometime a conversation that pharmacists usually have with their patients, that yes, it is a cost of $10 to $15 depending on the pharmacy where you go to, but you are actually saving your health from that long-term complications. So I think that's where the whole education part comes in. And I feel like if people have any questions about the coverage, about what is covered, if they need a prescription for a particular vaccination, your pharmacist would be the best person for you to reach out. They can sit down with you, they can look through your medication reviews, they can look at your records, and they can actually provide you some recommendations. Now, like you said, in Alberta and Quebec, we saw that they pulled off the COVID-19 for general population. It's only available for high-risk population. We recently did a survey at Canadian Pharmacists Association, and about 3 out of 4 Canadians said that they will not get a COVID shot if it is not covered by government. So I feel like that's where we really have to advocate. that if cost is an issue or a barrier to vaccinations, I think the policies need to be changed so we can have like an accessible coverage for everyone.
You could join our fight for that with the government. Liz, when we've spoken to our members, if a vaccine isn't covered, it feels like it's something that's nice to have, rather than something that would really be important to your healthcare.
Or that you
because we have a
need to
universal
get.
healthcare plan, but all of a sudden this is just an addition that you have to pay out of pocket for. And if it's in the hundreds or more of dollars, then that becomes I'll put that off until next year, or maybe I'll try something else to keep healthy.
Cost is a barrier, right? It's always going to be for everything.
It absolutely is. But I often frame it, there's definitely a cost to vaccines that are unfunded. People are in financial strain right now, but there is a cost to being unvaccinated potentially. And when you speak to survivors of significant vaccine preventable diseases with severe outcomes, I have the privilege of working with the meningitis B survivor community, and those are patients who are afflicted during their youth. That disease changed their life. They would pay anything to go back in time and purchase protection if available. So it's not a perfect argument, right? But I'm obviously dealing with patients, I'm in the trenches. I don't have a direct phone line to the government just yet, wish I did. But that's sort of the discussion I have with them too. But you're absolutely right. The illusion is that if it's not under the umbrella of coverage, it's maybe just not as important. And that's absolutely not true. If nothing else gets conveyed by what I speak here, you need to look at your age, your risk factors, and speak to your healthcare provider to coordinate what protection means for you.
And I think you raised a really good point that it's not just about getting sick at that time, it's about that long-term investment, right? Like if you end up selling your condo and not able to live on your own because you could have prevented that with a vaccine, I think that's really the message which people need to hear, that vaccination is important. It will prevent you from those long-term complications.
Dr. Bowdish, I want to ask you about COVID-19. COVID was one of the big concerns from the CARP member survey, and it partially because it was not going to be accessible to everybody. But can you tell us where we're at with COVID-19?
Absolutely. So COVID's unusual in that it still doesn't seem to be following the exact same seasonal patterns as some of the other viruses. So even over the course of the summer, it was a major cause of infectious disease hospitalizations. That would be traditionally a low point. And we're actually starting to build data now about the relationship between COVID triggering asthma attacks and COPD and other chronic health conditions. And, data that came from the 2022-23 season, 2023-24 season, did suggest that there are more COVID infections and the outcomes are still worse than influenza. Now, as we enter this season with the current variants we have, who knows? But looking at the Southern Hemisphere and other parts that have already gone through their wave, all those jurisdictions did see a really significant winter wave. Good news is our vaccine that we have in Canada right now looks like it's going to be a pretty effective match against the variants that are circulating now. So I can't stress enough that COVID is still here, and I would certainly want myself and everyone I know to be vaccinated against it.
Question, because the COVID tests are no longer free and floating around everywhere. You have to go and buy one. How are you tracking who's getting COVID?
Well, unfortunately, I am eternally frustrated by Canadian data because the only data that's really reliable is if they were hospitalized and had a COVID test there. But actually, in most hospitals in Canada, you don't necessarily ever know what the infection was, just that they were hospitalized, only if you live near a major academic medical center.
Okay.
So we end up having to use other countries' data about hospitalizations and to get a bigger picture who do more of that. As well, in Canada, we don't have a national vaccine registry, so it's also sometimes really difficult to find out who got vaccinated and do really reliable statistics on the degree to which vaccines could have prevented those hospitalizations. So you'll never hear a researcher want less data. We want more data and we want better data. So that's sort of where we sit right now.
Is the idea of having a national registry something that someone is working on?
Well, I've been in the field, I don't know, 25 years, and we've been talking about it.
There's been a lot of talk about it.
Yeah.
Okay.
So 2 points. Vaccine registry first. We don't have one. The portal is open, and there's obvious provincial differences, which are remarkably frustrating too. But we have a COVID portal. I know when my patients get a COVID shot, if they are tied to me officially. So the plumbing's there. Those yellow health cards still exist. It is 2025. We have something called the internet, right? And I think medicine notoriously, and quite to our own demise, has never been up with the technology. So just a bit of a shout out to Immunize Canada. They have an app you can download. It is free. It is coast to coast. It is multi-user, so you can keep track of your vaccines, your parents' vaccines, your children's vaccines. Especially if you're a part of that sandwich generation. It's not perfect, but it's some kind of
My producer happened to bring in her vaccination card. It's a little yellowed and it does look circa 19, I don't know what. But
very vintage.
This is great, providing you updated it, which is a challenge. My kids had something like this for when they went to school, but somehow we lost track. And during COVID, there was vaccinations that my daughter was supposed to do. And for the life of us, we can't figure out what happened. Did she or didn't she?
That's classic. So the other point relates to data. So as a community physician, a patient comes in with a cough. Unless they've had an expired rapid antigen test, that may or may not be effective. So the rule of thumb is a positive, a negative is maybe not a negative, but I don't have influenza swabs and I don't have RSV swabs. So that sinister cough comes in, we pretend that we can differentiate, data would suggest no. And I'm gonna be honest, sometimes I have inklings, but I don't know if I am treating conservatively because we don't really have medications, RSV, COVID, or influenza. It isn't until a patient ends up in hospital, which I am trying to avoid, right? That in some cases, certainly I have the privilege because I work in Toronto, triplicate tests are done for COVID, RSV, and influenza. The problem is the burden of disease is really in the community. So when you're advocating, and I'm gonna punt this back to Anthony, for coverage, if we don't have the data to show the incidence, the severity, the influx of patients, not just in the hospital, but in community clinics, right? It's hard to make a really solid argument for funding. So there's multiple levels of data collection, registries, testing. We have some work to do.
It seems overwhelming. I want to ask you about the symptoms, though, because for folks that are watching, we all think, well, I don't know, is this a COVID cough? Do I have RSV? Is this the flu? Are there specific symptoms or ways to distinguish between those?
So your doctor doesn't know, actually, right? You have a cough, you come in.
Yes.
Perhaps with COVID, there's something, you can hear wheezes, so that's sort of the inspiratory or expiratory sound that when a person is breathing out. There's a suggestion that maybe RSV has a bit more of a wheezing clinical presentation. With influenza, it really, if you have that fever and total body chills, perhaps it's influenza. But we really don't know. So if you have an underserviced healthcare system, access is a problem, right? We don't really know what we're treating. Let's look upstream and maybe vaccinate ourselves so that if you do end up with some sort of cough, and nothing's perfect, but maybe it's attenuated. And because you're vaccinated, I, as a clinician, can go home and sleep a little bit better at night because I know that you have some sort of protection for whatever you presented it with.
Right. And all this is to say there's still colds,
Yeah,
presume,
absolutely.
floating around that you just live with, right? You just live through. And we don't know if it's a cold. Right?
We don't know what virus necessarily is linked to symptoms, particularly in the throes of Canadian winter when it's also cough and cold season.
Yes, and we've lost Anthony for a few minutes because he just had, probably it was dust or something. I mean, I like to always claim, I'm not sick, it's just dust, but he needs to resolve his cough for a moment. Dr. Bowdish, I want to ask you about something that, has fallen off the radar, at least on public discussion lately, and that is long COVID. And if there are specific differences to when you're sick and you're getting long COVID, and what's the percentage of folks that are suffering with this?
Remember when I said I needed more data? This is a great example. So one of the challenges with long COVID is that we're all struggling to define what it is, because I think all of us have had a cold or a real illness that lingers, right? And you have a cough that maybe lasts for a month, or you have some symptoms, takes you a while to get back to work. So when does that end? And when does long COVID, which can be more long lasting, when does that start? As well, the good news is that in the era of COVID we're in now, and with reasonably vaccination rates, people are more likely to get better if they do have these lingering symptoms. So again, we don't have really good Canadian data. Probably the best data that's out there says that maybe 2 to 5% of people have symptoms at a month post their COVID. And most of those people will resolve it, and it's a reasonably small percentage of people that will have really long-lasting fatigue, brain fog, and things like that. Again, vaccination may not completely eliminate that risk, but it certainly reduces it. And some of the best data we have now says recency since last immunization is a correlative protection against lingering symptoms past a month. So all that to say, I don't have a good number for you, but the message is the same. It's if you get vaccinated, your symptoms will be less, and then when your symptoms are less, the chance of having long COVID is less. I will also point out, though, and I think this really comes back to the equity and access, long COVID doesn't hit everyone the same. So severity of the infection gives you a higher chance. Being female gives you a higher chance. Having a lot of comorbidities gives you a higher chance. Being of low socioeconomic class gives you a higher chance. So to me, this is one of the most compelling reasons to make sure we have equitable access to vaccines, because the disease is not equitable.
Right. Great comment. Dr. Palmay, do you find your patients understand severity of getting RSV or COVID or pneumonia? Do people understand what could happen?
So I have a phrase I say, you're well until you're not, right? And it's hard. Our brains aren't wired in the same way to catastrophize, 20 years down the road, 10 years down the road. So I'm going to use blood pressure as an example. A patient comes in, their blood pressure is high. They feel great. Why are you giving me a pill when I feel great? And I'm not necessarily, unless you're super high or super low, treating you because of your numbers today, but what those numbers mean over time. We've mentioned the long-term potential consequences of a vaccine-preventable disease, requiring long-term care, mobility issues, cognitive issues, accelerating the deterioration of whatever diagnosis you have. That's one longer-term issue. But if you think in the months or even a year after having a vaccine-preventable disease, RSV, influenza, shingles, there's significant risk of having a cardiac event, right? RSV, influenza, and with shingles in particular, a cardiac event and a stroke, right? So there's a few things that people understand. Being dependent and not being able to live independently is one. Stroke is very, very terrifying for patients, and I don't think that's a message that we convey enough. So once again, shingles, yes, it's a rash for 2 weeks. It ain't pleasant. Nobody wants it, but it's not just a rash. And there's subacute complications that are significant, and these longer-term complications. But we're not wired that way, and we're also wired to forget. During the throes of COVID, when we were in lockdown, not being able to spend time with our families, travel was taken away from us. If you can protect your time in any way, and perhaps it's not protection if you have risk factors to end up in hospital, but protecting your ability to spend Hanukkah, Christmas with your family, protecting your ability to go to whatever country you go to snowbird in the winter, that to me is also important, right? So I think context is important, and reminding ourselves, 'tis the season, it happens every year, and that's the reality of our Canadian winter, but I'm proud to be Canadian. I always say elbows up, open hearts. The Moderna vaccine is actually being made the COVID vaccine in Laval, right? So I think it's a time to say, yes, we have this tragic winter that's going to last somewhere between 6 to 10 months. Let's put on our armor. Let's put on our, go Jays go and get your shots type of thing. Buy your hockey tickets.
Okay, I like it. Go Jays, go and get your vaccine before you go.
Yes,
Before you
before you
go.
go.
People. Anthony, with the introduction of new vaccines and new data, it can be difficult to stay on top of what's the latest piece of information. How do you recommend people do that?
Well, trusted sources, and those trusted sources would be your family doctor, your pharmacist, but also everyone wants to go online and talk to Dr. Google, and there are terrific resources out there. I think the doctors will find that many of their patients come forearmed with lots of information, and hopefully it's coming from trusted sources and coming to the CARP website as well. We're advocating for those top five conditions and the vaccines that can match them, and I think always talking to your peers and your family and friends about, have you been vaccinated? What was the experience like? Because the more we know, I think the more likely and the more comfortable we'll be in getting those vaccines. So when you're visiting your local pharmacy to pick up something, I think you should talk to your pharmacist about the next vaccine available and seeing if it's something that's on your schedule.
That's great advice. And Dr. Bowdish, why do we have to get a flu shot each year and a COVID shot each year? Why can't we just get one that lasts us?
That is the dream. And there have been...
And one together.
Yes, that is. So there's 2 points there. It's influenza mutates every year. And so the strains, the flu shot you got 5 years ago isn't going to help you very much this year. It's not going to help you at all. So we have to do updates. And the COVID virus also mutates. So the original vaccines we all got way back when don't have any protection against these mutations. So the virus moves faster than we've been able to keep up, and that's been a real challenge. Certainly, there's enormous research efforts in trying to get combined shots, and one of the things that I think is really exciting about the mRNA technology in particular, pretty easy to mix and match and put a little bit of influenza in there, a little bit of COVID, maybe a little bit of RSV, and those are certainly on the way. Until then, we have lots of data about it being safe to get multiple vaccines at the same time. So generally, people will go and have a conversation about getting their COVID and flu shot and one in each arm, and that is an alternative until we do have that combo shot available.
Yeah, most of the vaccines, they are like, you can safely administer them together. So if you are at the pharmacy, you're getting a flu shot, get your COVID shot at the same time. It will not only save you an extra trip, but it will also save you for going through all the process. So until we have like that ideal combination, I think people should get both their COVID and flu shot together when they're at the pharmacy.
How much do you think the worry about the side effects that will follow? I'm not going to feel good, I'll be in bed all day, and I've got some. How much is that preventing people, do you think, from coming and getting a shot?
I think it all depends on their confidence. So I always say, like, yes, everybody worries about the side effect, and we often do get those questions from patients where, like, how long I have to be in the bed? I heard that you're going to get really sick. I'm going to get the flu because I'm getting a flu shot. But that's not the case. Like, the real situation is that you will feel a little bit of those symptoms, but they are just for like a day or two, and you can keep yourself hydrated during that time. Take maybe a pain medication, Tylenol or Advil, whatever makes you feel better, and then that's it. You're actually preventing the real disease. So that fear of that symptoms is not something that should stop people not getting their vaccines. And that's where you can actually talk to your pharmacist. I always say, like, people have a lot of questions, and sometimes it's good to talk to, if you are at your doctor's office, just take a quick second and ask your doctor, I'm really worried about this side effect. Is it really going to happen? If you're at the pharmacy getting your shot, ask your pharmacist. They will be able to explain to you what are the short-term and what are the long-term side effects.
And I find you only hear the bad side effects. I don't get side effects, I'm just going to be honest. Every time I get vaccinated, I feel fine, actually. But I don't walk around saying, I feel fine.
Exactly.
And people who don't feel good, that's what you hear about. So it's those few stories, and then you think that that's the way it's going to be for you. Dr. Palmay, I want to talk about pneumonia. That's a word that we hear a lot about, especially at this time of year. It's also one of those bit of a mystery, not exactly sure what it is, how it fits in. So when it comes to pneumococcal disease, is there a vaccine for that? Will there be a vaccine? How should we be approaching it as patients?
That's a bingo question. So pneumonia is a clinical diagnosis, right? One can develop pneumonia subsequent to many types of illnesses. So you can contract RSV and develop a pneumonia, right? But if you're talking about invasive pneumococcal disease, that's a specific bacteria that causes quite significant pneumonia. It can also lead to sepsis, so blood poisoning to a certain extent. We do have a shot that's available, and we have many different options, and they seem to update the guidelines every 6 months. We have some new ones down the pipeline. And currently, again, because of provincial differences in Ontario, we have coverage for one pneumococcal 20 for patients at 65 and over, or for some niche patients who are younger, who have a significant comorbidity that increases their chances of developing one of those complications, so meningitis, blood sepsis, and pneumonia. And then things are changing and they're evolving. So some people need updates, as a different updated vaccines come in with perhaps different properties that would make it more eligible or more protective for a certain type of patient. I'm updating, but we do have a vaccine. So that's just not seasonal, right? So when you're clustering seasonal vaccines, in my mind, I think of the triad of COVID, influenza. Now you're not getting a seasonal RSV vaccine, but RSV is seasonal in the sense of when it occurs, right? So that's the trifecta. But other vaccines that older patients, I never say older, I say you're an expensive vintage of wine. Other vaccines that are absolutely essential are shingles. So at 50, NACI, our national guideline body, would say that patients should be vaccinated against shingles. You have to make sure your hepatitis vaccines are up to date. I would include pneumonia as one of those important vaccines to consider out of the seasonality picture. And then your standard vaccines, make sure your tetanus is up to date, because if you stub your toe when you're in Puerto Rico, that's going to be a problem, if your tetanus is not up to date. So, there's routine vaccines that you need to make sure are up to date. It's like taking your car in to be serviced, right? Check your brakes. I don't know anything about cars. Check your muffler. Make sure the windshield wipers work. And in some ways, we are nicer to the things we own than the body that we own, right? So I do think it's absolutely essential that you not only think about vaccines as we approach, the hockey season in Canada. Another thing I know nothing about, but I'll throw it in, but talk about those standard vaccines that you also need to make sure are up to date.
Can you just elaborate on the shingles? Because folks will hear about it and they're, is it if you've had chickenpox or you haven't had chickenpox? I don't know if I'd had just if you could give us a quick summary on why it's so important.
Okay, so shingles, all part of the herpes family. Shingles is a reactivation of a dormant chickenpox virus that it has a little siesta in nerve root ganglions, so in sensory nerves. And as your immune system is challenged, aging being the biggest risk factor, and nobody has a solution for that yet, but other things, stress, other illnesses, things like that, it's like the Loch Ness monster. It rears its ugly head, likely at the most
inopportune. If you've had chickenpox,
you have to have chingle. You have to.
If you haven't had chickenpox, you can go get a coffee right now. What we talk about, like you're not.
Well, if you haven't had chickenpox, that's another. You need to be vaccinated against chickenpox. But if you haven't had a chickenpox infection,
right,
you won't get shingles.
Okay.
As we are vaccinating youth now, there's going to be a time period where. What are we going to do with patients who have been vaccinated? Because in theory, they're not going to have shingles because they've never had chickenpox. The point being, it's the reactivation of this dormant virus, right? And it's not fun. Everybody knows those pictures. It can have consequences that are not just a painful rash. If it affects the trigeminal nerve, you can have eye complications, you can have brain complications, right? And it packs a punch, that virus, it really knocks people out. But then segueing back to, subacute complications, the risk of a stroke, a heart attack. We know that a long-term condition called post-herpetic neuralgia, where it's a chronic debilitating pain condition, which increases as we age, the chance of you developing it. And we have an aging patient population, this silver tsunami in Canada. So we have patients most at risk. Thankfully, the vaccine that we have, which is 2 doses, still no booster in sight, has excellent persistence data. We now have 11 years worth of data that is serological, but we also have mathematical modeling that suggests that that immunity is going to be pushed out even further. So at 50, we have an indication from NACI, and then we also have a somewhat newer indication of 18 plus. So if you have an underlying comorbid condition, or if you're on medications that challenge your immune system, that increase your risk of having that reactivation, you are also eligible. Being eligible and being recommended is not the same as covered, though, right? So that's where the confusion lies too.
I will say, there's no one more enthusiastic about shingles vaccine than people
Absolutely.
who've had shingles.
They're lining up.
Oh,
It's a horrible
has anybody here had shingles? I'm putting you on the spot.
Luckily not.
My husband had it when he's immunocompromised, and I'll tell you, it is awful, awful, awful.
Well, you're well until you're not, right? So
Yeah,
that's
it's hard to describe until you've had it. And I know everybody does have a different experience, so there's like severity can be really severe versus light. But on that note, I can't remember if I had my second shingles vaccination. It's a blank. During COVID, things were a bit of a blur for me, so I have lost track of a lot of vaccinations and dates. So, Dr. Faisal, where can someone go if they need to know where they stand with this, with their vaccination?
That's a really good question. Like, we were hoping there would be a national vaccine registry where we can have all that data about each individual, but we don't have that. I feel like we have some structure that we saw during COVID when we have those QR codes on our phone and we were showing people. So I think my wish list would be that we could have a system like that, but we don't have anything currently. Maybe somebody has to pick that up and make that structure. But I think you can, there will be 2 places that I would suggest you go. Go to your family doctor. They will have your record of your immunization. Ask them what you have received. Go to your pharmacy. So if you are using a consistent pharmacy,
Yes.
they will have the record of your vaccination that's been done over there, and they would be able to give you some information. And like you said earlier, we still have those yellow card, and it is a huge issue because if you have taken your flu shot at your pharmacy, but then you have taken some other shot at your doctor office, and then if the doctor office and the pharmacy are not talking to each other, there is no way that we can keep that on track. And that immunization record is really important, right? Like, not just for your own record, but you may need it for some kind of work that you are, or volunteer work, or even if you're traveling, right? So I think there has to be a better system for us where we can have like a centralized system where anyone who get a vaccine should get their data input. But right now, I would say, 2 places you can get your information is from your primary care physician and your pharmacy.
Pharmacist.
Or download that app. I have nothing to do with the app. I just think it's wonderful. And
There's
keep
an
us out. The Can Immunize app.
Okay.
Free, downloadable, Canadian. It's not perfect, but it's a registry that you can have. I always joke that people forget their health cards, but nobody forgets their phone. So
That's true.
they can flash.
Do I have to put my info in it, though? Does
do.
it require me to do the work?
It's
That's
not,
where it falls down.
and it's not linked to anything. Yes, it is. It is a nice way for you, as the individual being vaccinated, to hold your data.
Liz, excuse me, Liz, when we talk to our members, they say, well, I got the shingles shot 15 years ago. Should I get the new one? Or I got the pneumonia shot 10 years ago. Should I get the new one? Maybe that's a question on behalf of my members. What should they be talking to their doctors and pharmacists about?
So it depends on risk factors. The shingles vaccine, the older iteration, we no longer have, and NACI would recommend that absolutely you receive the new option.
How long has the new option been around?
Since 2019, I believe.
Okay.
So the older vaccine has been phased out. It just simply wasn't as effective, particularly in the older patient populations. It was also a live vaccine, so you couldn't give it to patients who are immunosuppressed, whereas our new iteration is better. But yes, you should receive both doses of the new one if you haven't already. But those patients are few and far between. For pneumococcal, that's a Venn diagram with extensions happening. Most people should get the updated vaccine, and some people need regular dosing. So that's a personal discussion with your primary care provider.
And silly question, can you over-vaccinate? Like, if I made a mistake and
if you don't know,
I forgot when I got the COVID vaccine, or let's say I had COVID and I didn't know it. Now I'm getting the COVID vaccine. Is there any danger to that?
No, there's no danger. It's one of those things that COVID does provide you a little protection against COVID. So if you've had it really recently, the recommendation is you can wait 6 months. But if you're not going to know because you don't have rapid tests, we don't worry about that. And there's really not any possibility of over-vaccinating yourself. We just actually published a study to try to put people as mind at ease, where we looked at people who'd gotten frequent COVID vaccines because they were in those really vulnerable groups. And we looked at every scary thing that could happen to the immune response, and none of it happened. So we're pretty confident about that.
And cases where it's impossible to find a vaccine record for several reasons, COVID made data keeping impossible. Immigrants, I just give them the vaccine, right? It's better to err on the side of caution than not.
That's very reassuring. That's really good to know. And Dr. Bowdish, I'm going to talk about measles and whooping cough, where Canada could lose its status, measles elimination status. Whooping cough, my father almost died of it, I think in 1940s in Scotland. When I had my son in 2007, I got a letter from public health 3 weeks into his birth, because I went to the pediatrician's office. Someone there had tested positive for whooping cough. And I was like, how's that even possible? So first of all, how is that even possible, and where do we stand with those?
Yes, well, this is one of the reasons I love working with the CARP membership, because they remember how dangerous these infectious diseases were and how problematic they were in childhood. Of all the vaccines we've had, measles has saved the most lives, because unlike other respiratory infections like influenza, RSV, it actually kills the immune cells that hold your immune memory. It makes you vulnerable to all sorts of terrible things. And that's why pneumonia is a risk, and brain swelling is a risk, and sepsis is a risk with measles. They're horrible. Whooping cough, like you said, used to kill a lot of babies. We've got there because vaccination rates have fallen. And some of those reasons are due to the family doctor crisis. Childhood vaccines are traditionally done in that setting, not in the pharmacy setting. We've not been able to track. I've had no end of people who thought they needed one measles vaccine and were shocked that it's a two-dose regime. Not being able to track, that's a problem. Misinformation, of course, is a problem. And underfunding our public health units to do the follow-up. Once upon a time, you couldn't get into a public school unless you'd shared your vaccine records. Those rules are still there, but if there's not the funds and the resources to enforce them, then many people, may not even know that their kids aren't up to date. So it's really been a systems problem of letting these things fall apart because they were working very well, and this is a reminder that vigilance is key. Vigilance is absolutely key.
And we all play our own part. Anthony, you've been saying for years that access to health care shouldn't depend on where you live, but in some cases it does. So can you talk about CARP's vaccine advocacy work and the progress that you've made?
Yeah, equity was a word that came up earlier, and I think that's an important part. Your postal code really shouldn't determine where and how you're able to access vaccines. Depending on your provincial funding status, depending on how many vaccines they're paying for, they're purchasing for the province. Are they paying for some of it, for all of it, or none of it? So depending on your postal code and what your province has decided to fund, that's going to determine your access to these vaccines. So CARP is advocating to the federal government to really bring the provinces together and say adult vaccine and adult immunization really should be equivalent to childhood vaccinations. We're sure to make sure that younger Canadians have access to the best available vaccinations. The same should be applied to older Canadians. The doctors have all described how our immune systems decrease and the vaccines are really necessary. And if the government isn't funding them, then they're leaving us more susceptible to those knock-on effects of getting those illnesses. So CARP is advocating for some federal hand in a provincial jurisdiction. And I think if they work together, we can make sure that Canadians are getting the vaccines they need.
Great. Dr. Palmay, I'm going to say this panel's evidence. There's a lot of smart people working on this subject right now, but we all have a part that we need to play. What can you tell our viewers, what kinds of things do we need to be thinking about?
Well, I think, so right now we're in the beginning of respiratory season. We're actually already into it. Make sure that you've updated your seasonal vaccines, right? So influenza, in most cases, I am recommending a COVID vaccine. Guidelines have changed for sort of lower risk patients, but age, over 65, we're still recommending you're getting 2 shots. As was noted, it's not quite seasonal. It will sort out COVID will sort itself out eventually. If you are at risk, your RSV vaccine, make sure that's up to date. That is not an annual vaccine, and we have data rolling in about 3-year durability protection. And then, go and I have patients who book appointments to do a vaccine checklist. Right now, I am in the trenches of advocating for vaccines, so I'm constantly looking at people's charts. But take control of your health and go in and say, look, I am 52 years young. This is my, remember me, I have COPD. What vaccines do you think I should have? Trusted resources. The internet can be a dangerous place, but we have some wonderful websites. So Can Immunize is where you can download that app. Immunize Canada. CARP's website was mentioned. There's a wonderful group that's run out of Waterloo that has a website that has patient information. Speaking to a pharmacist when you go. And so I think that, not being passive about, if you are doing a proactive measure, such as vaccinating yourself, be active about the process and constantly update, your knowledge and understand that, your vaccine's going to be updated.
Can I add something to that?
Of course.
I often say vaccination is a family affair too.
Yes,
It's interesting, our National Advisory Council on Immunization actually recognizes that influenza is actually helpful if a caregiver of a vulnerable person gets vaccinated. And there's an amazing study that came out of McMaster showing that vaccinating children protects the older adults in their lives because they carry that. And so flu shots are really, truly a family affair. They can have a knock-on effect to people who are more vulnerable. The data, we're still waiting for the data on COVID, but the data we do have also suggests that there is some of this protective effect if caregivers in the circle of care around that, although it hasn't officially made a recommendation state. And RSV, we'll wait and see whether childhood vaccines has a knock-on effect of protecting older adults. But families have a role to play. And if you have an older adult in your life who you care about and you want to protect, getting your own flu shot is also, even if you're not a high-risk group, a proven way of helping to do that.
And just to add, the perfect storm of virus propagation is staying indoors, little bioterrorist children who are wonderful, but they're harbor of disease. Bioterrorist children hanging out with their grandparents, as they should, inside, indoors, when all these viruses are moving around. 'Tis the Canadian season, so I think that's our reality. And we deserve to gather and, have our celebratory events and have generations spend time with each other. And in order to do that, you're right, a family affair.
Family and friends, right? Because our friends are our family too. Anthony, can you just add what we can all do to help amplify CARP's message?
Well, as an advocacy voice, we want our members and anyone tuning in today to contact their MPPs who are running the financial side of the provincial healthcare plan, and also talk to your federal MPs and say, listen, you need to play a role in making sure that Canadians have access to vaccines. So being a CARP member, joining your voice with ours and calling for more investment and making sure that vaccines, the best available, best in class, and recommended vaccines are available to all Canadians.
Great, and I'm just going to offer you all a final word before we wrap up. If there's something that you really just, the most important takeaway right now, based on what your experience is, I'll start with you.
I'll just say that one of the things I'm excited about in Canada is vaccine sovereignty. So we learned in the pandemic that we cannot always rely on out-of-country manufacturing, and I'm really pleased that we've actually brought some of that home, and we're doing that. But that's another thing that our federal advocacy asks need to work around. Not only does it make incredible jobs for my students, which makes me extremely happy, but it helps bring that home. So a little bit of an elbows up story. We can do this. We have the best vaccine researchers in the world. Why not bring manufacturing to Canada as well?
I like it.
Absolutely. I think my parting comment would be active, be proactive, be involved in your healthcare, and ask the questions. We're talking about vaccines now, but I think every level's of preventative care. Make sure your mammogram, colorectal screening, I package everything as a holistic tune-up. Make sure you're tuned up.
I like it.
I think I'm gonna remember 3 C's. So confidence, if you are not confident about your vaccination, if you have any question, go talk to your healthcare provider, whether it is your family doctor or your pharmacist. Ask them the question, they will be able to answer you. The second thing is about convenience. So pharmacies are local, everywhere. If you have to book an appointment, if you have to do a walk-in, go to your pharmacy, get your vaccination. And the third thing is about cost. If you have any questions about whether the vaccine is covered for you, do you need to pay for that, go talk to your pharmacist, because they may be able to sit down with you and find out if you are specifically covered for that specific vaccine, and they will be even able to call your insurance company and find out if you have a private insurance who can cover your vaccine for you. So I think about all those 3 C's whenever you have a question about vaccine.
And don't assume anything,
Don't
right?
assume
Don't
anything.
assume. Okay, Anthony,
Well,
final word.
I'll use some letters. 2 I's, investment and insurance. So we want the government to be investing in these vaccines, and these are an insurance policy for your own health. So take advantage of that opportunity that's provided to you by these professionals and invest in yourself and ensure your health by getting a vaccination this year.
I feel better already. I do. I have my shots tomorrow. So thank you so much for joining us. We really appreciate your time. It was excellent. Thank you to all of you who are joining us online. When it comes to vaccines, remember, talk to your doctor or your pharmacist, find out what's recommended for you, and be sure to keep yourself healthy.